So there are concerns over what seems to be growing vaccine hesitancy. Government officials are urging people to register and get the jab. Let's discuss what causes hesitancy with Kate Alexandra, who is with the UJ's Center for Social Change. Kate, thank you so much for making time. So initially, research had actually found that about 70% of adults were willing to be jabbed. Is the figure dropping now, given how many people are refusing to be vaccinated? We were hearing the figure of 10,000 just last week in Gauteng, the 10,000 almost of teachers who didn't want to take the vaccine.
Well, the benchmark figure is one that we developed based upon research we undertook in late December, early January. And that was a very large sample, and it allowed us to look at the reasons why people were vaccine hesitant at that particular stage. So that was 67% of the adult population saying that they either wanted to take the vaccine or probably would take the vaccine. And since then, there have been a number of surveys asking similar questions, not always the same, different sample sizes, perhaps slightly less rigorous in terms of the breadth of population that were interviewed. And those figures have gone up from the 67%. So that looked very good. Now, we don't know what's happened in the last month or so. And it's possible that the figure's gone down below 67%. We've got a survey, this UJ HSRC survey, very big survey, that's in the field at the moment. So we'll be able to give you a better understanding of the level of hesitancy when we get details from that probably later in the week.
Yeah, and apologies there, Prof. I just went straight to your name, but it's Professor Alexandra, so please accept my apology. What is this hesitancy attributed to? Because often you hear of wrong information that people have. There's sometimes language barrier, there's transport issues, especially in rural areas. What is it attributed to?
Well, there's clearly a range of factors, and they're going to vary depending upon class and age and so forth. I think one of the key things we need to understand is that it's not 67% across the board. It varies from one district to another, one province to another, and in particular, what concerns us, it varies depending upon whether people are insured or whether they are uninsured. Insured means that they've got medical aid. And what's interesting here is that when we did our survey in early January, what we were finding is that people who were least hesitant, most wanting to take the vaccine, tended to be poorer people, less well-educated people, people in urban areas, informal settlements, and so on. Now, those are the people who are not getting the vaccine. The people who have done much better at getting the vaccines have been better off people, those who are insured, those with cars and so forth. And it's really quite dramatic, the difference. So from a presentation that I was looking at about 10 days ago from the government, the proportion of insured people of the over 60 age group who were vaccinated was about 50%, so it would be about 50% by now. The proportion of uninsured people, that is poorer people who had been vaccinated, was only just over a quarter. So a massive difference. So part of the question we have to ask ourselves is, why is it that poorer people are not being vaccinated? And from more recent research that I've undertaken with colleagues, what we find is that a key issue is getting to the vaccination stations. And if we look at the number of people who are registered and compare that with the number who are actually vaccinated, then it makes complete sense. So there's a high number of people registered, but they're not being vaccinated. And a key factor does seem to be the difficulties, the cost of getting to the vaccination stations. And we must remember that these are people who don't have cars, that have the cost of a taxi in most cases, because the vaccination stations are often far from where they live. So we have to sort out this problem. The Minister herself spoke about getting the vaccines to the people, which was a good sign. But it has to be done now, and it's not being done yet.
How do we sort it out, Prof? What should government be focusing on in trying to address this?
Well, we think that mobile teams would help a lot. The Gauteng government was talking about starting doing that today. I don't know how well it's worked. I was a bit concerned to see that some of the examples they were giving were about registration at pension queues, and it's not registration that matters, it's the vaccination. So we need to have vaccinations that are closer to people, not registrations. In the two provinces that have done best so far, KZN and Limpopo, they've had mobile teams, and we need to look into how effective they've been. So these are actually key questions in terms of increasing the level of vaccination. I don't want to pretend that they are the only issues, however. There is obviously a lot of concern amongst people that they don't know what the effect of having a vaccine will be. Maybe it'll make them ill. All sorts of stories and rumours are spread, and they're not necessarily countered by government communications. And then there's miscommunication, and the miscommunication happens partly because of language. So we had an interesting example at a meeting that I was at the end of last week, where one person was saying to another that the government wanted to take Vaseline. And this was a simple misunderstanding of the word vaccine. So we have to get far more information out to people in their own languages, in languages that they understand. And this isn't being done by the government at the moment. There's very little information going out in languages other than English. We've had research going on in the Western Cape this week where complaints from Afrikaans speakers, mainly coloured people, that they don't understand what's going on. So there's a problem here. There's a problem in terms of, I think, lack of funding for communication in the government. But also, although the government talks about the need to have a whole government approach, we don't really see that happening very much, I don't think. We've got problems with the police not enforcing regulations in many areas. We have, in terms of communication, in terms of television even, there seems to be lack of input from the Department of Communications so that we can sort out these issues of whether or not the television stations get paid for inserts dealing with the problems of communicating messages.
Yeah, well, money is busy being looted, Prof, and a lot of that money could come very handy in helping with communicating better to these far-flung areas. Were you surprised, Prof, that it's not just the teachers? In fact, there are different groups when you talk about vaccine hesitancy. I was personally surprised that that also exists within the health industry. There are some health workers who actually refuse to take the jab.
Yes, I wasn't particularly surprised by it because of the survey data that we've got. And it's often been better educated people who have been more reluctant to take a vaccine. I think in the end what happened with the nurses, if I understand the data there, is that there were quite a lot of nurses reluctant to start with, but then it speeded up. And not all of the nurses were given the J&J vaccine because they missed out on that. And then some of them went into the into Pfizer and into the programme for the 60+. It may well happen amongst teachers, but 10,000 teachers in Gauteng is actually not a lot. So I wasn't surprised, and that doesn't in itself worry me so much. What does disturb me is the general level of vaccination, the slow pace of vaccination, and the fact that it's particularly bad amongst poorer people. And I don't hold poorer people responsible for that at all. The problem is, how do we get people from where they live to the vaccination stations, or how do we get the vaccination stations to where they live?
Yeah, Prof, thank you so much for coming through and chatting to us about this research that you have done, giving us an idea as to what extent vaccine hesitancy is a problem, not only among teachers, but among other groups as well, including health workers. Professor Kate Alexandra is with the UJ's Centre for Social Change.